a good rate to start?
I would go with the minutes instead, that way you can count how many minutes you walk. Ideally, it's like a whole day. That's what I said. If you're not able to do 30 minutes of walk continuously, don't do it. You need to do it 10 minutes or 5 minutes and take a break. And then you need to do a moderate level, like a bit of moderate pace than a slow walking. But I will suggest if the people who is a beginner will start with a slow walk for 5 minutes and not able to do 30 minutes, you don't need to worry about that. Something is always better than nothing. Your heart knows, your body knows that this is a beginning of something. So if somebody doesn't want to go out, walk inside the home. If you are someone don't want to walk inside the home, walk while standing. The way Shiva told that the step, count the time, like, okay, today I did like 4 minutes. Maybe the next time I'm gonna go like 4.5 to give my heart a bit of booster and control the blood sugar level. Please begin. Something is always better than nothing.
Thank you so much, Kawal. And last follow-up is in terms of fitness, is there, if you're sedentary, is it really important to have walking and weight training? Is it one that's better than the other? Is there anything that you could recommend if you have not been active? What is your suggestion?
My suggestion is start with first walking. It's a basic need of the body. And some of the flexibility exercises I have shown, if you can do a bit sitting on chair, which is fine. If you are totally sedentary, don't do the weight training all of a sudden. Just walk for a week or 10 days and see how your body goes. Your body will tell you better than anybody. So that, okay, I can manage that. If you are totally sedentary, please start with the walking and strengthening. I don't think so. Breathing exercises will give you anything. You are just going to sit and do some breathing exercises. My basic rule is prevention is better than cure. I always tell people, prevent it as much as you can. And something is always better than nothing. If you are a beginner, please start even with the 2 minutes of exercises, but just start. So and breathing, which is very easy, sitting on chair, doing nothing, just to breathe, which is a normal basic process of our body. Yes.
Thank you so much for this amazing informative presentation, both the presentation and the demo. And we just want to let everybody know that we have a copy of Kawal's presentation that we'll send a PDF with the organizers. They can send it to anybody who's registered in case, you want to have a look at it if you missed some screens. And again, we want to thank you so much for presenting today. We really appreciate it.
Thank you so much.
Okay, so having Kawal presented, now we're going to be moving on to the next speaker. We have Jaswant Mara. She's going to be presenting steps to manage diabetes. She's a registered nurse and a diabetes educator, and she's going to tell us how we can manage diabetes and the steps to take. So I'm going to turn the presentation over to Jaswant. While Jaswant is setting up, if anybody has any questions, please type them in your chat box, and we'll be collecting the questions, and we'll be doing a Q&A at the end of the presentation when the rest of the speakers have presented for today. So whatever questions you may have, please type them in the chat and we'll be collecting them shortly. So with that, I present you Jaswant. Thank you.
Oh, hi, Seva. Hi, everyone. I just wanted to test if everyone can see my presentation slides and you can hear me okay.
Yes, we
can.
Yes,
we can.
Perfect. Thank you. Thank you, Seva. And hi, everyone. Once again, I will be talking about the steps to manage diabetes. So you guys already listened to a wonderful presentation from my colleague, Kawal, and she talked about the exercise that is part of diabetes management as well. So what I'm going to talk today is, before I get into what are the steps, how we're going to manage the diabetes, I'm going to just briefly touch base on what is diabetes actually. What are different types of diabetes we see, and who's at risk of developing diabetes? Is diabetes serious? And then we'll talk about how do we manage diabetes, or how do we control our blood sugar levels. So just to answer that question, what is diabetes? As you probably all are aware, when there's a lot of sugar in our blood. So too much sugar in the bloodstream is something called hyperglycemia, or high blood sugar level. So how do we get the sugar in the blood? When we eat food and we drink, then the sugar level from our food gets into the blood, and then from the blood, it gets into the cells of your body so that you can get energy to do your day-to-day activities. So when these cells are not able to use the sugar from your food or drinks, and you don't get energy, that sugar stays in the bloodstream. And then when that happens, you feel tired because you didn't get the energy from the food. And then how does that sugar get into the cells of our body or in the blood? So when we eat food, it breaks down into small sugar particles called glucose. And that glucose needs to get into the cells of your body so that you can get the energy. However, it cannot get into the cells by itself. It needs some support, it needs some help. And that help comes from something called insulin. Insulin is a hormone that's made by pancreas, and in our body we have pancreas, and the job of the pancreas is to produce insulin in response to the sugar, so that the sugar in the body can be put into the cells and you get your energy and you can do your day-to-day activities. But what happens with diabetes? Either that insulin is not produced enough to match the level of sugar in the body, or the insulin is being produced, but the cells which supposed to be using that insulin aren't opening their doors to let the sugar get in them. In either way, the sugars stay in your bloodstream, and then that makes your sugar levels to go higher. So that is in a nutshell what is diabetes is. So when the sugar doesn't get into your body cells, you don't get energy. What are the typical things people will tell me they feel? They feel they are very tired, they eat well, they sleep kind of okay, but they still feel very tired. And then there's a lot of sugar in the body, and we keep eating, obviously, all the meals we're supposed to eat. But what ends up happening is the sugar isn't going where it's supposed to go. It ends up in the washroom. So we go a lot of times go to the washroom and urinate it out. And then when you go to the washroom too many times, then you feel thirsty. So you'll drink a lot of water. So those are very typical symptoms of somebody with high blood sugars, that they'll go to the bathroom pretty often, they'll be drinking a lot of water, or they're very thirsty. And then obviously they're very tired because they're not getting the sugar for energy. So now let's talk a little bit about, we know what is diabetes or high blood sugar is. So there are different types of diabetes that are out there. Very commonly, we see type 1 diabetes, type 2 diabetes, and gestational diabetes. There are other types of diabetes there as well, but common ones people experience are type 1 diabetes, type 2 diabetes, and gestational diabetes. So the type 1 diabetes is when the pancreas doesn't make insulin and completely shut off. It doesn't make at all any insulin. People do require insulin, and from outside, something like insulin injections. Somebody with type 1 diabetes, if they don't take insulin, they cannot survive. So insulin is the only alternative. And usually type 1 diabetes is diagnosed very early in childhood or adolescent age. Some young adults do develop type 1 diabetes. It's body's autoimmune response that the body kills all the cells that produce insulin. So that is type 1 diabetes. The only treatment is available currently is the insulin. Then type 2 diabetes, which is a very common type of diabetes, and a lot of our South Asian people have type 2 diabetes. It's also called lifestyle disease sometimes. So in type 2 diabetes, as I was explaining to you earlier, the pancreas doesn't produce enough insulin, or if it produces, the cells doesn't use it for energy, and that's called insulin resistance. So that is type 2 diabetes. So the The other thing happens in type 2 diabetes as well is because our body is so tired because we're not getting the sugar, the liver, that's another organ in our body, that actually feels, okay, this person isn't getting the sugar, this person is tired, although we have lots of it, it's not being used. The liver will also send out sugar as well. So that way, it's already high in the blood and the liver is spilling out more sugar as well. That can also happen in type 2 diabetes. So the third type commonly seen around is gestational diabetes. It is a type of diabetes that occurs during the second or third trimester of pregnancy. So the women who are pregnant in their second or third trimester, their blood sugar levels will go high. And all pregnant women who are in the second trimester are usually screened for gestational diabetes around 24 to 28 weeks of pregnancy. And if their sugar levels are out of target range, they are usually sent to the diabetes education centers where they are managed with the help of a dietitian and endocrinologists and nurses who are certified diabetes educators. So those are typically, what type of diabetes we see. And as I was saying, type 2 diabetes is a common one. So now comes to the next question: who is at risk of type 2 diabetes? As I was telling you earlier, we as Silesians are very high risk of developing type 2 diabetes. And if somebody has a family history, have grandparents, parents, brother, sister have type 2 diabetes, they are very high risk of developing type 2 diabetes as well. Aging, obviously, we can't control that. Anybody over the age of 40, their risk increases to develop type 2 diabetes. If somebody's obese or overweight, or they are very sedentary lifestyle, not being active, or they have had gestational diabetes, and then they can also develop to type 2 diabetes. So for all our audience today, I will share my presentation. And in my presentation on this slide, you have a link that you can actually click on and check your risk of developing diabetes, if you are at high risk or not. So it's called Chanas Questionnaire. So you basically go through the questions and then you will get a score at the end, and that will sort of indicate you or tell you how much risk you have to develop type 2 diabetes. Now, we know what is type 2 diabetes is, or different types of diabetes. So it is basically high blood sugar levels. Is it serious? Do we need to do anything about it? And if we don't do anything about it, what can happen? So if the blood sugar levels are uncontrolled, there is a very high risk of developing diseases, because the blood is circulating in all of our body. So it's part of every single part of our body. So if somebody isn't doing anything about diabetes, which sometimes I've seen a lot of patients I speak to that, it's just diabetes. I'm just taking my pill. What else I need to do? I'm taking care of it. But again, there is multiple things you can or may do, and we'll talk about that in momentarily. But if we don't do anything about it, there is a very high risk of people to develop something like heart attack or heart disease. The stroke can happen. People can develop blindness. And then there is something, the kidney damage can happen. Sometimes people have to go for dialysis because their kidneys aren't functioning anymore. Nerve damage can happen. People feel like, okay, their legs and feet at night, sometimes during the day as well, they feel like tingly, they have pain. And sometimes if you get or develop a wound, especially on the lower extremities or feet area or the legs, those wounds will take time to heal. And sometimes they don't heal, that people end up having, unfortunately, amputations. So you can help prevent these risks by having good blood sugar control and by seeing your physician and your diabetes education team. So now, how should I control, or how should we control our diabetes? So there are multiple things you can do. So Kamal earlier did a wonderful presentation talking about activity. So that's part of your lifestyle modification. So you can do some, if you're not active, try to get active. And how to do it, Kamal explained it beautifully before. Healthy eating, that is another very important aspect of how to manage diabetes. And my colleague after me will be talking in very much detail of healthy eating as well. So I'm not going to talk about these two topics now. But the other things you do need to do other than lifestyle management is testing your blood sugar levels, taking your medications appropriately, and managing your stress, and knowing what are some of the other targets or healthy blood sugar levels, acceptable blood suger levels, what other tests that you need to be doing on regular basis to know how is your rest of your body doing. So we'll talk first about, I'm going to skip the activity level, as you already know now, that you can do some walking, swimming, dancing, or any sort of movement. And that will help you control your blood sugars. It will eventually also help you lose some weight if you're planning to. It will improve your circulation and relieve your stress. So exercise or activity is a wonderful thing to do. And I will definitely encourage you to continue with exercise or activity. And now the testing blood sugar. So sometimes people ask me, well, I take my medications, I'm trying to eat healthy. Do I really need to test my blood sugar? Absolutely. Why would you test your blood sugar? Because that will be telling you, whatever you're doing, is that working for you? Helps you to know if the food you're eating or activity you're using, is that helping you to control or bring your blood sugars down? Or you can see the patterns. Sometimes, after dinner, your blood sugars could be very high. For some people in the morning, first thing, their blood sugars could be high. So the way, if you notice the patterns, the treatment plan can be adjusted as well. So maybe after dinner, if your sugars are high, maybe there is something in the diet you can change. Or maybe the medication you're taking in the morning is not enough. You may need additional medication. So all those things we can determine by knowing how your blood sugar levels are. And there are different ways of testing. So we used to just have a finger prick to do a blood test. Nowadays, there are other options of testing blood sugar are available as well. Something called flash monitoring, continuous glucose monitoring. And in all your areas, there may be different government coverages for these things, but there are options like, as I said, the continuous glucose monitoring or the flash glucose monitoring by Freestyle Libre is very commonly used, like a sensor is implanted on your arm and then you use your phone app or a little reader scan, and that's how you can check your blood sugar level. To know more about these things, I would suggest you to speak to your family care doctor or your endocrinologist or your diabetes team. They'll be able to explain you more about it. Now, the next thing is, what are the targets so of our good blood sugars? So where do we want these blood sugar levels? When we check in the morning, so we look forward to have sugars between 4 to 7. If you check 2 hours after meals, we're looking between 5 to 10. So those are some of the target blood sugar levels that we wanted to maintain. So now, when should I check my blood sugar levels? Again, that varies with the medications you're taking, definitely. But what I would recommend for commonly, you would check it at different times of the day. You can sometimes check before a meal. Other times you can check 2 hours after a meal. Let's say you had a special dinner today that you think is healthy and you want to see, well, is it really going to help, keep my blood sugars in check? Check 2 hours after that meal. And then the other good time to check is at bedtime before you go to sleep. And first thing in the morning, a lot of times I've noticed patients I speak to or see, they would say, I check first thing in the morning and my sugars are great, but they don't check any other times of the day. So the only time checking in the morning isn't sufficient sometimes, because you only see a part of the picture. You want to see how your sugars are during the day as well. So alternating it, and then after a couple of weeks, you have different sort of tests available, like you had it in the morning, you had it after lunch, before dinner, bedtime. You can see the patterns, and your doctor or your diabetes team, they will see the patterns and they will be able to determine whether we need to make some more adjustments in your treatment plan or your lifestyle. So that would be helpful that way. So now let's talk about the medications. So what are the different medications that patients are usually on? So a lot of you may be familiar with metformin. So metformin is a pretty, I would say, a very common medication prescribed in type 2 diabetes. It helps to decrease the sugar made by the liver. It helps those cells which are rusty and not opening the sugar to get in them. It helps them to become less resistant. And then there is another medication sometimes people take is called the gliclazide or glyburide, glimepiride. So those are common names we hear or see. So what those medications do, they work on the pancreas, helps the pancreas to produce more insulin. But when you're taking these medications, the risk is, because it's working on the pancreas to help you produce more insulin, and if you are eating well or you're sick for any reason, or whatever reason may be, the they help you to produce more insulin, but there is not enough sugar to match that, there is a risk of low blood sugar. And I'm going to talk about that in momentarily as well. So as I was saying, so metformin, gliclazide, glucagon, those are some of the medications patients used to be taking. But nowadays, I've seen a lot of patients are on some other medications called Jardiance, Januvia. They are great addition to the diabetes treatment plans nowadays because they help, like Jardiance or Invokana or Farxiga. These are the medications that helps you not just with the diabetes management, it helps with your heart. It helps with the lowering blood pressure. It helps with the weight loss. And the medications like Januvia, like Tradjenta, these are great medications, again, not just for diabetes. It helps you with, keeping you a little bit full. Then there are some medications which are injectable. So again, these are not insulin, but they are injected sometimes once daily. Others are like once weekly. They improve your body's ability to control blood sugar levels, as well as decrease your sugar made by the liver. It makes you feel more full, helps you sometimes lose weight as well, and it may sometimes help people with other than the good blood sugar control. Once the sugars are in better control, obviously you have less risk of developing other complications that can happen with high blood sugars. So the other medication is insulin. As you know, as I was saying, type 1 patients do need insulin right away, but sometimes patients with type 2 diabetes, they take oral medications, sometimes the pancreas after, because it is a lifestyle disease as well as it's a chronic condition. So over time, patients can sometimes, their pancreas isn't producing enough insulin at all, that oral medications aren't working for them, then they will be needing insulin. And it's not a bad thing to take insulin, because that is another thing I get from a lot of patients. Is my diabetes bad now because I'm taking insulin or I'm prescribed insulin? Absolutely not. It's just that it is a chronic condition. It is going to progress. So as it is progressing, you just have to have right treatment so that you can keep your blood sugars in check, so that you don't develop the problems with high blood sugar levels. But when you're taking insulin or some of the oral medications, as I was talking about earlier, like glyclazide or glimepiride or glucagon, then there is a risk of something called low blood sugar or sugar levels going too low. So if you have your blood sugars too low, you need to treat that immediately. So what is a low blood sugar? Anything less than 4, if you test on your meter, sugar less than 4 is called low blood sugar. And how would you know that your blood sugar levels went low? You may feel symptoms like, headache, blurry vision, shaky, nervous. Sometimes you're just in a happy mood and all of a sudden you feel like you want to kill somebody, but really, really angry, which is unusual for you. Anxiety, shakiness, feeling tired, weak, anything unusual than your normal feeling, and you are taking some diabetes medications which can result in low blood sugar, I would strongly encourage you to check your blood sugar. And if your sugar levels are 4 or below 4, that means you need to treat it immediately. If for some reason you're out and you don't have your meter on you can't test, but you feel these symptoms, I would encourage you to treat it anyway. It's rather having a little bit higher blood sugar than a risk of low blood sugar is okay, because if you don't treat a low blood sugar, then there is a very high risk that it can get worse quickly. People can pass out and sometimes they can die if that treatment is not given. So how do we treat a low blood sugar? As Kamal said earlier, keep a candy on you. So similarly, you need to have some sort of fast-acting sugar that can help you to treat a low blood sugar. So usually we recommend about 15 grams of fast-acting carbohydrate in form of glucose tablets, 3 to 6 tablets, or you can have table sugar, 3 teaspoons or 3 packets, or you can have some fruit juice, like 3/4 cup of fruit juice or regular pop. Again, please make sure you don't drink too much of the fruit juice or the pop as well, because if you do, it will help you to bring your sugars up, but they can go higher, way too high, that you will be having high blood sugars afterwards. Once you've done that, the step 2, sit down, rest, and check your sugars again in 15 minutes. And once your sugars are better, the next step is eat your meal if it's mealtime, or eat a snack so that it doesn't go down again. If you have the low blood sugars consistently, I would recommend that you would talk to your family doctor or your doctor who's taking care of your diabetes to just assess if your medications need adjustment. And then let's talk very quickly about stress. So stress does increase your blood sugar levels. It also increases your heart rate, your blood pressure. So it is important that you deal with your stress levels, learn some relaxation techniques like yoga, try to be active or exercise, and get support from your family and your friends and your physicians. And some people do smoke to relieve your stress. I would say if you are a smoker, it's probably temporarily helping you feel better, but it is actually affecting you so bad that you wanted to think about actually finding alternate ways of dealing with your stress. Set a date to quit your smoking, talk to your healthcare team about it. So again, as I was saying, I'm going to share this. I'm open to share this presentation with you guys. So other than keeping your blood sugars in check, there are other tests that you wanted to do and keep them in check as well. So there is a list and that I won't be talking in detail about now, just because of the time constraint we have here. But these are some of the tests you wanted to do and keep check of, like your A1C level, your blood pressure, your kidneys, your cholesterol levels, your teeth. You need to see your dentist once a year. Your eyes should have dilated eye exam once a year. You need to check your feet daily to make sure there's no cuts, because they can become severe. Again, manage your stress. And if you're a smoker, try to talk to your team about reducing or quitting your smoking, and managing your diabetes, taking control of your diabetes, because you wanted to live a quality life, and you can. It's not that you have diabetes, you cannot. You certainly can. You just need to know, how do I manage my diabetes? What are the steps I need to take to keep my blood sugars and my diabetes in check? Testing your blood sugars on a regular basis, taking your medications, being active, reducing your stress, and then eating healthy is very important as well. So that's what I wanted to talk today. And I will pass it on to Siva again so that she can discuss the next presenter with you. But any questions we'll take, I believe, at the end of the presentations today. Thank you very much for listening to this presentation, and I hope you learned something today.
Thank you, Jaswant, for that excellent presentation. Yes, we'll take the questions at the end. We want to do something new, which we had not done. By special request, we are going to have a short 5 minutes bio break. So we will come back at 12 o'clock. So please don't go away too far. And in 4 minutes, we will start the session. Shiva will start the session. So we'll have a little bit of a break. Thank you all.
Hello, everyone. We're going to be starting the second half of the programming. And I hope you've been enjoying your presentations this morning. They've been just incredibly informative and they've been all awesome. So we have the second part now. I'd like to introduce our next speaker. We're going to be speaking about vegetarian diet and how and good sugar control. This is going to be presented by Fatima Panjani. She's a registered dietitian. She's a diabetes educator, and she's been with the diabetes chapter for many years. And this is going to be an amazing presentation. So I'm going to turn it over to Fatima. Here's Fatima. Thank you.
Good afternoon, everybody. I hope you're having a nice time listening to all our presentations. And I'm going to present to you on vegetarian diet. So, and how the vegetarian diet actually affects our blood sugars, and how can we control the blood sugars when we are eating a vegetarian diet. So I think many of you may be vegetarians and some of you may not be vegetarians that are attending our program today. But sorry, one second. My slides don't, oh yeah, perfect. It's a little slow in going forward. Okay, so, but one of the main things, whether you are a vegetarian or you're not a vegetarian, the principles for a dietitian to look at always are that the diet that you are eating should be nutritionally adequate so that you can achieve and maintain overall good health, right? So depending on whether you're a vegetarian or not a vegetarian, or vegetarians can be of different categories, whatever diet is appropriate for you, we want that to be it should be nutritionally adequate so that you can maintain your overall good health, right? So that's what we are going to talk about mainly, but now in a vegetarian context. So like I said, vegetarian diets are also, could be a variety of different types of vegetarian diets. So before I get into that, I just want to use another term, plant-based diet. So now more recently, in recent times, I find that the shift in terms of using the terminology of plant-based diet is more common. You will hear this term more and more, and it's exactly the same as vegetarianism. I think just the concept of vegetarianism was more rooted in different cultures. It was rooted a little bit in certain religious aspects. And so to get away from those religious and cultural restrictions, they've started using the term plant-based diet, but it means exactly the same thing. So I'm going to use the term plant-based diet for the rest of my presentation, just for uniformity kind of thing. So a person could be a strict vegetarian or use only plant-based items, and we call them a vegan because they will not use any other thing from animal origin. They could be a flexitarian, where they have a little bit of flexibility in terms of they are a vegetarian and use only plant-based foods predominantly, but then they may use certain food items such as chicken or fish. If they are outside their house, they may not cook it in their house. They may eat it ready-made outside of the house, or they may, when they're at a party, they might have a little bit of fish or chicken or something like that. So it's a little bit of a flexible attitude, if you can call it. So it's flexitarian is what we call it. Then we have the third category, which we call pescatarian, which are vegetarians who will have vegetable-based diet, plus they will have seafood and fish. And then we have ovo-lacto-vegetarian, or sometimes just lacto-vegetarian. So ovo refers to eggs. So people who will have a vegetarian diet and will eat eggs as well. And lacto refers to dairy. So it could be milk, yogurt, and cheese, and paneer. So you could be an ovo-lacto-vegetarian where you consume eggs as well as dairy. So there are some different variations to plant-based diet or vegetarian diet. Whatever type of plant-based diet or vegetarian diet you use, the bottom line or the aim for a healthy plant-based diet is definitely that we want you to consume nutrient-dense plant foods, so that the diet that you're eating gives you adequate amount of nutrients and a variety of nutrients. So you're not missing any one nutrient from your diet. So that's one of the aims of a vegetarian or a plant-based diet, which is also the aim of any diet that you're doing. This is what we want you to sort of aim for. The other thing that we want you to focus on is minimizing processed foods. And I've highlighted the word processed food because I want to focus a little bit on this. And this is where we kind of we fall into a trap over here. So processed foods, basically anything that we get from nature. So for example, let's take wheat. When we get wheat in nature, wheat has a little bit of a husk on top of it. You may call it bran, you may call it husk, you may call it fiber. It has a little bit of a germ inside in the center of the wheat grain. That's, again, we call it fiber or bran or germ, wheat germ. But when we use this wheat in our regular day-to-day use, we remove that husk, we remove that germ, and we use the soft part of the wheat and grind it into our flour. This is partly, this is processing of the wheat grain. So what we want is, in order to maintain a healthy diet, we want to minimize the processing of the food. So we want to eat them as close to their natural form as possible. So when you're looking at wheat and you're looking at wheat flour, we want you to have unprocessed, or not unprocessed. We are going to still make it into flour, but it's using the whole wheat grain to make flour out of it. So whole wheat flour or whole grain wheat flour is what we prefer over just wheat flour. So white atta is processed wheat flour, whereas whole wheat atta is processed flour in the sense that it is ground, but it uses the whole grain. So that bit of processing is what we want to minimize. And that's one of the things that not just plant-based diet, but any good healthy diet will focus on. Do not process your foods. Use them as close to the natural form as you can. We also, in a plant-based diet, minimize the use of oil and animal products. So animal products such as eggs and dairy and other meat sources are a source of a lot of saturated fat. And so we want to minimize that. That gives a huge benefit in terms of nutrients that you get from the plant-based diet. The third aim is, of course, it encourages a lot of vegetables, whether it's raw or in the cooked form, whether it's, we also want you to have a lot of fruits. We also want you to have a lot of beans, peas, lentils, soya beans, and in small portions, we want you to have seeds and nuts. Using a lot of vegetables, fruits, and a combination of legumes and lentils, we use products which are lower in fat. Can I request everybody to mute themselves? I think there are some Zoom users which are not muted, and it's causing a little bit of an echo of their sound. If you could mute yourself, that would be great. Thank you. So what should a plant-based diet look like? So this is a rough sketch, and I'll leave you at the end with one of the diets, and I can actually also email a handout to the organizers about a particular diet which is called portfolio diet, which is actually a plant-based diet. But if you want, more details and nitty-gritty in terms of what percentage of your food should come from what category, the portfolio diet is a good diet to follow, and I can forward a handout. I have a couple of slides on that at the end, but if required, I can forward an actual handout to the presenters and they can forward it to the participants. So predominantly, the plant-based diet is going to be based on vegetables because that is the main form of plants that we eat, right? So different types of vegetables. So we want to eat a variety of vegetables because that really helps in giving us different kind of nutrients. The colors of different vegetables actually represent the different antioxidants, the different vitamins and minerals. So try and get vegetables from different categories. So if you're having brinjal or bagan or eggplant, which is purple, try and get some green vegetables in combination. If you're having some carrots, then have some greens. If you're having some greens, do a yellow or something like that. So 2 colors, 3 colors will give you a combination of different vitamins and minerals and antioxidants. The second category is fresh fruits. Again, we want it fresh if possible, but even fresh frozen is as good as fresh as well because they're frozen in the peak of its nutrient content. And when they are frozen, they don't lose a lot of its nutrients. It's not that it doesn't lose all the nutrients, but it doesn't lose most of it. So let's say 90% is retained. There are some nutrients, especially vitamin C is a big concern when you freeze items because over short periods of time, vitamin C is destroyed very quickly. But there are many other ways to get vitamin C. So it's not one of the nutrients that I'm worried about that you will not get through fresh fruits and fresh vegetables. If you're eating a combination of fresh and frozen, you'll still get vitamin C. So our basic part of our diet should come from vegetables and fruit. So half our plate should be vegetables and fruit, but more vegetables, less fruit. And just going back to the vegetables, we want vegetables in a combination form. We don't want all just cooked vegetables. So if I'm having eggplant today, which is cooked, that's in the cooked form, then I need some vegetables in a raw form. So I can have peppers, I can have a salad with, lettuce and tomato in it, a combination of cooked and raw. And so like we talked about vitamin C with destruction of vitamin C when we take frozen foods, if you have a combination of raw and cooked vegetables, from the raw side, you will get vitamin C. So the nutrients that are destroyed in cooking and freezing, you get them when you have raw fruits and vegetables in your diet not only on a daily basis, at every single meal. Lentils and legumes are our next category. So lentils and legumes are very good source of proteins, as well as good source of good types of carbohydrates. But again, what I want you to remember is have them in their natural form, or as close to the natural form as possible. So for example, when we talk about dals, you have the whole masoor dal, the pink dal, which is, the whole grain, which actually is not pink. It's pink inside, but it has a skin on it. And so it looks brown in color. So the brown masoor dal, and then you have the pink masoor dal, which is, they've taken the skin out and the inside of the dal is there. So as much as possible, have it in its natural form, so with the skin on. You will not get all the dals with their skin on, but you do get masoor dal with the skin on. You do get the mah dal with the skin on. You do get the tuar dal with the skin on. So as much as possible, have it with the skin on. The skin is the fiber, and the fiber is the most important thing in our diet. It's difficult to get enough fiber. So small ways like this will help us get more fiber. Legumes, the same thing, again, as much as possible in the natural form, closest to the natural form. So any combination of legumes you can have. There's a lot of varieties. Soya beans, edamame, they are the highest form of protein. So if you don't eat, if you're a strict vegetarian or vegan, you don't have protein from any animal source, you don't take eggs as a source of protein, you may not even take yogurt, Greek yogurt, which is a good source of protein, you may not take that. Edamames and soya bean are a very good source for protein. So that's a very good alternative. And things made from soya bean, so you've got soya nuggets, you've got soya buddies, you've got vegetarian protein, vegetarian patties, vegetarian other options of vegetarian stuff, which has a bigger percentage of soya bean. They are very good sources of protein. A quick difference between chickpeas and kala chanas. And so they are both chickpeas, but different in color. But what is the nutritional value of the chickpeas and the kala chana is quite different. The kala chana give us a lot more protein and a lot more fiber than the chickpeas do. Don't get me wrong, chickpeas are very good too, have them as well. But the kala chana actually is a powerhouse for protein as well. So another option that we might want to look at, which many of us, we like chickpeas more than kala chana. It takes a little bit longer for the chickpeas to cook, and perhaps we just don't know that they are chickpeas and they are chickpeas. So what's the difference if I have chickpeas versus kala chana? There is a difference, right? So getting kala chana into our diet is also another good. I also, one of the things that I do recommend to my diabetic patients is using the kala chana atta. So not besan, you get kala chana atta, using a little bit of that and a little bit of soya atta to mix to your whole wheat atta to make the quality of your atta much better. So it's a multigrain atta. If you combine whole wheat atta, so maybe 3 parts of whole wheat atta, 1 part of kala chana atta, and 1 part of soya atta, make your roti with that. The soya atta will give you more protein. The kala chana atta will give you more protein and a little bit more fiber. For fiber, you can add a little bit of barley flour. But again, 3 to 4 parts of whole wheat atta and 1 part of the other attas that you add. Mix that atta and make your rotis out of that. Because of the protein content of the soya beans and the kala chana, the roti will still be soft. It won't be hard. So protein keeps it soft. The fiber makes it a little bit harder. So a combination of two types of flour, soya and maybe barley, soya and kala chana, to your whole wheat atta keeps the roti soft, but it improves the quality of your flour and it improves your blood sugar significantly. Since roti is our main carbohydrate, I think this is something that a lot of us can do, very simple things, but it makes a huge difference in our blood sugars. So again, grains, and again, we talked a little bit about whole grains, we talked a little bit about wheat. So looking for the word whole grain when you're buying anything which is based, which is made out of a grain. So whether it's cereal, it's bread, it's flour, whatever you're picking, look for the word whole grain. Look for the word whole wheat. The word whole is telling you it's using that husk and that germ of that grain, which gives you some protein and fiber. So try using that. Nuts and seeds are the next category, but nuts and seeds are very healthy for us. They give us the good oil, but they have a lot of oil in it. So something like oil, which is healthy oil, which is good for us, a lot of it is not better for us. We still need it in small portions because it's very calorie dense. So we don't want to increase our calories too much as well, right? So small quantities. So what is a small quantity for nuts? So if I look at the center of my palm, if I use this as a measure and put some almonds in it, it'll come to about 15 to 16 almonds, small handful. That portion of a combination of different nuts and seeds can be used on a daily basis. If you're having more, the calories add up very quickly. As a rough idea, approximately, so different nuts and seeds have different caloric value, but on an average, I would say half a cup of nuts or seeds will give us anywhere between 350, 400 to maybe even 600 calories. And an average person may require between 1,500 to 2,000 calories. Somebody who's very active may require a little bit more calories per day. So if 500 calories we are getting from nuts in one shot, that's a quarter or a third of our calories of the day. So be very mindful of the nuts and seed quantity that you're having. They have very good oil. It's important to have a small amount, but not too much. The last two items on my list, dairy and eggs. Again, so this is for ovo-lacto-vegetarians, but just a quick note. Dairy does give us calcium, vitamin C, which is important for us. So if possible, if you're using dairy, then I would want you to use 1% or skim milk, whether it's milk, yogurt, or cheese. Use low-fat dairy options like 1% skim milk, cottage cheese. 1% is excellent choice for good protein and good choice for vitamin D and calcium. So when you look at the percentage, 1%, 2%, 3%, it's actually telling you how much fat is in that. It's not about the percentage of calcium in it. It's about the percentage of fat in it. So going lower is just reducing the fat. The amount of calcium and the amount of vitamin D in it remains the same. Eggs, again, they're a very good source of protein. If you use eggs, 1 egg a day, boiled egg, scrambled egg, use minimal oil in preparing your egg, then it's a good choice to have in the day. So, so how does the plant-based diet reduce the risk of diabetes? So just to give you sort of a little bit, I'm going to start with the third point on this slide, just to give you an idea in terms of numbers. So the prevalence of diabetes among vegetarians is 1.6 or 2 times lower than what it is among omnivores. So omnivores are people who eat vegetarian as well as meat, right? So just moving from or stop eating meat and meat products and becoming a vegetarian, we reduce our risk of developing diabetes by 50%. And this is research-based. These are not figures that I'm pulling out of a hat. These are research-based figures. So that's a huge number, right? But what are we doing to get there? I'm just going to read from the slide. So the consumption of refined carbohydrates, saturated fats, processed meat, and sugary drinks increase the risk of type 2 diabetes, especially when combined with the low consumption of dietary fat. So when we move from an omnivorous diet to a vegetarian diet, what do? We cut back refined carbohydrates, which we can cut back if we are omnivores as well. But when we are omnivores, it's very difficult to cut back the saturated fat and meats in the diet. So we can still move away from processed meats to healthier choices of meat, which reduces the amount of saturated fat that we are eating, but there is still saturated fat in meats. So moving from eating meats to just vegetarianism, we do reduce the risk of diabetes for ourselves. So these are some of the things. And of course, as we move to more of a plant-based diet, the caloric intake reduces because animal protein, animal diet is higher in calories as compared to plant-based diet. So even weight by weight, if you have 100 grams of an animal protein or animal product, so let's say we have 100 grams of even fish, which is a healthy choice, but yet it's animal choice, versus 100 grams of vegetables. 100 grams of vegetables will be much lower in calories as compared to 100 grams of fish. So weight by weight, it's much lower in caloric value. Okay. So the mechanism, I just want to go, and so some of this Jaswant has covered in her diet, but I'm just going to touch it very, very slightly. So you heard the term insulin sensitivity from Jaswant in her diet, in her presentation. Basically, vegetarians who have higher fiber content in their diet, it improves their insulin sensitivity. So the insulin that their body is making is more sensitive or is more effective in getting those blood sugars out of the bloodstream and into the cell. So Jaswant said, you know, the doors of the cell sometimes are locked, they're not opening. But if you have a higher fiber diet, these doors open easier. Insulin is the key that opens this door. So the insulin is more effective in opening these doors. That means it's more effective in moving this sugar out of the bloodstream into the cells. And inside the cells, this sugar is giving us energy. If it's not going into the cells and we are peeing it out, we are tired, like this one said, and yet the sugar is there, the energy is there, but it's just not being used. It's just causing damage to our body because it's circulating in the blood again and again. And, you know, sugar molecule is a little bit of a sharp molecule. So running inside the bloodstream, it causes damage to our blood vessels, right? So we have to be careful for that. The other thing is in terms of reduction of risk is when we replace saturated fat with unsaturated fat. So animal sources of fat with vegetable sources of fat, that helps decrease insulin resistance. So this, if you look at the picture that I have, if we have more saturated fat, this gentleman slowly over time is developing a little bit of visceral fat. So fat in the abdominal area causes insulin resistance. So vegetarians have less visceral fat, and therefore it helps, you know, with insulin sensitivity and reduction of insulin resistance. If you have a vegetarian diet, you tend to, you know, have better weight control. And so that also helps to reduce your risk of insulin resistance and increases your sensitivity of insulin. I'm just going to check the
Fatima?
time.
Yeah. This is Eva. You have like about a minute if you could just conclude. Yeah, thank you.
Okay. All right. So just a few things that I find that are important to mention over here. 2 nutrients, vitamin B. Vitamin B12 deficiency is one of the common things that vegetarians have, and we have to supplement vitamin B12. Supplement vitamin B12 from outside. Vitamin D deficiency is something that it's not just people who eat plant-based diet have. Everybody has, so we all have to supplement because of the weather in Canada. So vegetarian diet equals good health. I'm not going over this slide because we went over all this stuff. I just want to go over 2 items. Vegetarian diet, plant-based diet is a very healthy diet, but we sabotage ourselves. So 2 things that we do to sabotage ourselves is 1, we use processed and refined flour to make our food items. That is one of the things that we should try and avoid. And the other thing is, even though we're not using animal sources of fat, we copy that. So we use banaspati ghee, which is actually copying the butter or saturated fat, which is actually worse. It's trans fat, and that really causes problems with our diet. So those 2 items are very important for us to look at. I talked a little bit about in the beginning about portfolio diet. I'm not going into the detail of it. I just wanted to show it up front to you.
Fatima, we're really out of time. So what we're going to do is we're going to address some of this over the Q&A. Okay, we still have one more presentation. We have Q&A. Sorry. But What I want, because I just need to make sure, because everybody is here until 1 o'clock. What I want to make sure is some of the points that you have in the slide, if we can kind of have it part of the Q&A, that would be great. And I really appreciate it. Thank you so much. Okay, thank you, Fatima. It's an amazing, amazing presentation. By the way, for everyone who is attending, everybody will be getting a copy of the presentation. So you will have a presentation that'll be mailed to the organizers, and that'll be emailing to everybody who's been registered today. So I really, really appreciate your time and your presentation, Fatima. I learned so much. Thank you. We're going to move on to the next presentation, which is going to be a debate. Actually, we have Dr. Ali Prabtani and Dr. Tab Khan. They're going to be presenting a different type of a presentation today. It's going to be actually a debate. It's going to be about lifestyle changes versus diabetes medication and what is better. So without further ado, I will have Dr. Prabtani and Khan join us, and they're going to be debating with their slides and say, hey, which is better? So I want you guys to give a huge, huge applause. I know we're on Zoom, but it's going to be amazing. So thank you. And further ado, here is Dr. Prabtani and Khan.
Thanks, Siva. This should be fun. I wanted to thank the Konkani Foundation, first of all, for inviting us for this wonderful seminar. The sessions have been excellent, and they're all my colleagues. They're so competent. So congratulations to all the previous speakers. Secondly, I wanted to thank Siva, who's been our glue and our leader. And without her, we wouldn't have progressed. So Siva, I just wanted to thank you for all your work and your passion and your advocacy over the years. You're my partner in crime here and my sister. And thank you for everything that you've done for this chapter. Dayabai was my resident, and now he's a colleague, but more than that, he's a brother. Hopefully after this debate, we'll still remain friends, Dayabai and our brothers, because it's friendly, and hopefully we'll still talk to each other. But I just wanted to share some information with you, showing how important lifestyle is, and medications maybe not as important as we think, right? That's what I wanted to start off with. So before we talk about lifestyle, our previous presenters covered a lot of this stuff, but I wanted to summarize. So what is a healthy lifestyle in a snapshot summary? So it has several factors to it. Number one, achieving a healthy weight. And we know from studies and personal experience and data that even a small reduction in weight, 5 to 10% weight loss, can reduce significant amounts of glucose levels, your blood pressure, your cholesterol. So you don't need a lot of weight loss to actually get metabolic and health benefits. Just a little bit of weight loss can be significant. Your clothes may not fit with that much weight loss, but you'll get a lot of other medical and psychosocial benefits. So what's an active lifestyle? And this was also talked about earlier on, but we use the minutes, roughly 150 minutes a week. And I think Jas talked about this, is that something is better than nothing, or was it Cowell? Maybe it was Cowell, but the bottom line is something is better than nothing. Even 129 minutes is better than 0. So whatever you can do it. And the key thing is do what you enjoy. Walking, swimming. You don't need to join a gym and pay all that money. We're getting some beautiful weather, at least in Eastern Canada right now, Southern Ontario. So do what you like and do it with your family. Make it a family thing, and take your pet out if you have a pet. Number 3, healthy diet. This is really important because we know that saying of what you eat is what you are. That is so true. So even with South Asian foods, which I can never stop eating because I love my South Asian foods, and in our culture, that's what we need. We socially gather over food, which is such an important thing. But we can modify our foods to make it healthy. So low glycemic index. Fatima talked a lot about healthy diet and plant and so on, and so it's really important to look at these things, low glycemic, so we don't get those spikes in blood sugars, and you can also improve your cholesterol and so on. And try to eat small portions. The problem in our culture is we very heavy at nighttime. So maybe we should be eating more lighter at nighttime and smaller portions, but still on a healthy basis. And lastly, although this is not like a food or anything, but we have to really try to avoid other non-healthy habits. We know that smoking is detrimental not only to our heart, but it's a major risk factor for lung cancer and perhaps even breast cancer, etc. And excess alcohol can cause other damages also in excess. And too much worrying. We shouldn't worry about things we have no control over. Easy to say, but having a nice family support and then meditation or yoga, whatever you do, this can help alleviate some of that stuff. So if we can understand what healthy lifestyle is, we can I can go on to the next slide and sort of convince you and prove to you and make a Dayabai cry over this, saying that medications aren't as important. So why lifestyle first? I'm going to have 4 or 5 key points that I wanted the audience to take away today. Number one, a healthy lifestyle, whether it's exercise or activity or weight loss, not worrying, it will definitely improve your glucose levels and an A1C. Like I said, even a small reduction in weight, 5 to 10%, will significantly improve your sugar levels, whether it's fasting, after meals, before meals, and your A1C, which is a 3-month average of your overall blood sugars. This is well known based on lots of studies we have. We have lifestyle prevention studies showing weight loss has an important impact on improving your glucose control. So I hope that helps you understand that lifestyle is very important for improving glucose. But is it just glucose? No, it goes beyond that. A good lifestyle, unless you overdo it, has no side effects. It's safe, no side effects. Where medications, some of them can cause a lot of side effects. Stomach upset, dehydration, urine infections, fungal infections. Diet in the right way, activity done safely, has no side effects. No side effects. So another reason that lifestyle is so important and critical for achieving good glucose control and other health benefits. Number 3, we talked about no side effects. We talked about improving glucose levels. What about other things? So you're looking at one thing, just lifestyle. It can do many, many other things. It can reduce blood pressure. It can improve arthritis if you have weight loss. And we all know how bad arthritis can be. If you have a lot of weight, it can put a lot of strain into your joints. It can improve sleep apnea. In fact, some people can even come off their CPAP, that machine, after talking to your sleep specialist if you lose a significant amount of weight. And what's really important that people don't realize is going for a nice walk, a brisk walk, or a run, whatever is healthy for you, or swimming, can really, really improve your mental health and your mood. We all know that. We all feel better. We release all these chemicals on our brain when we do vigorous activity, which is vigorous for you. And especially if you do it with family members or your children or your grandparents or friends, you're going to feel even better. Because while you're walking, you're going to be talking to each other and catching up and so on. So a lot of benefits with the lifestyle there. And for a lot of us, we all want to look nice, and especially in the summer, go out and take off our jackets. Your clothes will fit better, right? We all know that. So another benefit of it might cost you a little bit more. You might need to spend a little bit more to get some new clothes, but you'll feel better and hopefully look better about yourself. So number 4, exercise. It's free. Which medication is not free? All medications cost. Even if you're over 65 on Ontario Drug Benefit, someone's got to pay for it. The taxpayers pay for it, so it's not free. Well, walking is free. What do you need? You need a pair of good shoes, and that's all you need in the summer. In the winter, you got to wear your jacket, but you already have a jacket anyways, right? So exercise is free. You can do it in your backyard. You can do it outside. You can do it in a mall. You can walk up and down the stairs, and that's a very good way of exercising. So it's free. Medications cost money. Okay, so there's many types of exercise. I don't like to use the word exercise. Actually, I should change that to activity. There's many types of activity. You can walk, you can ride your bike, you can swim, you can climb upstairs, you can walk around your home. So many things that I've already talked about. And the important thing is that you don't have to be doing it all at once. You can take breaks if you're working and do a little bit of walking around the house, or take a little walk outside, take a little stroll outside. So as long as you accumulate a certain number of minutes, that's better than nothing, as Kawal mentioned earlier on. Number 5, I've already talked about just what lifestyle can do for diabetes, but what if you don't have diabetes? We know that a healthy lifestyle, weight loss, activity, change in your diet can also prevent diabetes if you're at risk. And just by being South Asian, over the age of 40, having a family history, gestational diabetes, these are all risk factors. And being overweight, we're getting type 2 diabetes. So we know, based on this data we have, that if you lose weight in particular, and not too much, we can prevent. And prevent's probably not the right, but we can delay the onset of type 2 diabetes mellitus. Now, what about medications? Side effects. Side effects. Who wants side effects? They don't always work. They cost money. Some can cause even weight gain, and some are injections. Who wants to take injections? It's not fun, right? And they're not natural. Medications are not natural. Plant-based food is natural. Walking around is natural. Losing a little weight, we're supposed to not be overweight, is natural. So just another reason that lifestyle is so important. So that's what I wanted to end off with. I'm going to come back again after Tayyab has his discussion and tries to coerce you to the other side, but that's my point. Tayyab?
Thank you very much, to the organizers for having invited me to the talk. I will just share my screen and get started. I hope you can see my screen. Just a thumbs up from anyone would suffice.
Yes, we can.
Okay, all right. So thanks so very much once again. I'll be talking about and trying to convince you that it's actually the other way around. Before that, just a few disclosures. I have certainly worked for some of the drug manufacturers, but I'm not representing them. These slides are all my own. And in addition, a disclaimer, Ali Bhai helped train me. So any strengths you find in the presentation are because of his training. Any weaknesses are mine. And I'm not trying to argue that, I'm not trying to minimize the effect of lifestyle changes. They certainly are important. But the question is, which is better, medications versus lifestyle, which is more effective, if I may, for management of type 2 diabetes. I'll try to keep it relatively simple. We'll review the evidence, just sort of high level, bullet point stuff for diabetes prevention, diabetes treatment, and in regards to complications of diabetes. And we'll try to see, take a dispassionate look at what the evidence suggests. So why is this important? I won't belabor it. Diabetes is very common. It is much more common in our community, and it leads to multiple complications. Head to toe, you name an organ system, and diabetes, can cause complications, heart attack, stroke, you name it, kidney damage, eye damage, etc. So this study basically came out when Ali Bhai was close to graduating. He's actually graduated medical school and he was in his training. And this was a seminal study. What it showed was that lifestyle changes help delay the onset of diabetes more effectively compared to medications. The medication that we had available then was metformin, along with a few others. So with lifestyle changes, we could delay onset of diabetes by up to 58%. With metformin, it was roughly half of that. So that led to the postulation that exercise, 150 minutes of aerobic activity was more effective than medication for delaying onset of diabetes. Fast forward 15 years, when Ali Bhai was basically training me, this other study came out that basically showed that a medication that led to about 6% weight loss, shown in the blue graph here, shown in the red graph here, was more effective than lifestyle interventions in delaying the onset of diabetes. So with this, just about 6% weight loss, and we saw roughly close to 80% decreased risk of developing diabetes compared to lifestyle factors. So all of these patients, in the blue line, did receive lifestyle advice, around healthy eating, physical activity. So the point I'm trying to make is that lifestyle changes can be effective. Certainly they are. And, in that earlier study, we showed that they were more effective than medication. But today, we have much more effective medications than we had about a decade or a decade and a half ago. And, in today's day and age, there are even more effective medications than the medicine that was studied here. So suggesting that meds could be more effective in delaying the onset of diabetes. How about effect on glucose control? So there's, hemoglobin A1C, which is a measure, 3-month measure of glucose control. Nutrition therapy can decrease hemoglobin A1C by about 1 to 2%. And usually these patients are what we call treatment naive. They're not on any treatment. So it is medications are more effective when they're used in those individuals. What evidence do we have about medication? So, just last week, this new medication was approved. So when it was added on top of existing medications, even insulin, only this one medicine could lead to about 2.46% reduction in the 3-month glucose control. So if this one medicine could trump everything that we can do through lifestyle interventions, I think that goes on to show that meds can be more effective in those who would like to achieve a better glycemic control. And when we add other medications, we can achieve an excellent glycemic control in these individuals. Risk of complications. So this was a study, look-ahead trial, everyone basically, they wanted to run it for about 13 years to see if lifestyle interventions could decrease risk of heart disease, heart attacks and strokes. So everyone received, dietary advice. They were advised to be physically active 175 minutes a week, slightly more than our Diabetes Canada recommendations. Essentially, it was a neutral study. It was stopped early because there was no evidence of these interventions in terms of reducing complications, heart attack and stroke to be exact. Subsequently, in the non-diabetic group, we have had evidence of Mediterranean diet in reducing risk of heart attacks or strokes, but that study was not specifically carried out in those with diabetes. And this is just a list of studies. Dr. Praptani and myself, we have a hard time keeping track of studies that have shown effectiveness in reducing risk of heart disease, reducing risk of heart failure, reducing risk of kidney damage in those with diabetes. Granted that these studies were mainly carried out in those who had pre-existing disease, so pre-existing heart disease, strokes, etc. However, we do have emerging evidence that even in some patients who don't have those pre-existing disease conditions, these medications can be effective. So I hope that I have tried to convince you that while lifestyle interventions can be effective against diabetes, the central question before this debate, before this house in the debate, was that are medications more effective? And I would humbly submit that medications are indeed more effective than lifestyle interventions, not only for prevention of diabetes, but also for its treatment and to reduce risk of complications. There was a question in the chat box about diabetes reversal. And we do have evidence, and I can show that to you, that even for diabetes reversal, medications are more effective compared to lifestyle interventions. So with that, we get to the end of my debate, the first part at least. I'd be open to questions, and I think that there is time for rebuttal as well. So it's back to you, Alibai.
Great, thank you, Taibai. So interestingly, when Taibai started his presentation, he focused a lot on lifestyle. So I think he's in agreement with me. So I'm not sure how you put all those lifestyle slides in there, Taibai. So I think it's clear that lifestyle, even from your end, is more important. So I'll leave it at that. So what's the bottom line? How am I going to convince you? I've already tried to tell you and give you information that lifestyle improves glucose and A1C levels, which is your long-term glucose control. It's safe and it has no side effects. Unlike medications, right? Medications cost money. Lifestyle is cheap. It has other health benefits: blood pressure, arthritis, mood improvement, sleep apnea. Your clothes fit better. Imagine that, clothes fitting better. Isn't that important? And it can also prevent diabetes. But what I wanted to say, at the end of the day, to the audience, I wanted to leave with one last comment, is that both are important. Taibai and our friends, we're still going to talk to each other. We're brothers. So really, this was just a fun debate. We wanted to present both sides. At the end of the day, really important, both medication and lifestyle are important. They work together. So don't omit one for the other. And the medications are very effective to reduce heart disease, many of them, kidney disease, diabetes improvement, but lifestyle, you got to work together. So that's what I'm going to leave with, and I'll pass it over again to Taibai before my last slide. So remember, you're in control of your diabetes. Be happy, enjoy life. And remember, take a little time to do it right now, or take a lot of time to do it later. I'll leave you with that comment.
I couldn't agree more with quite a few things that you said, Alibai. So these things are not mutually exclusive. So lifestyle changes versus medications. Ideally, both yourself and I would not want our patients to be on medications. But the reality of life is that most of them eventually do end up being on medication. So, with the theme of what's been discussed before, I think if we can prevent diabetes, through lifestyle interventions and control it through lifestyle interventions, all of us, including myself and all of us, would be happiest, without any side effects. However, there does come a time where lifestyle interventions are not enough, or even at the initial diagnosis, we know that for some patients, lifestyle interventions are not going to be enough to bring those patients to targets, to bring their A1Cs or glucose levels down, or to reduce the risk of complications. And I think for those patients, medications can be an adjunct to lifestyle-based therapies. Most of the studies that I cited, were the use of medications alongside lifestyle interventions. So they do tend to go hand in hand. But if the time comes, or if we know that lifestyle interventions are not going to be enough, then keep an open mind about medications, because we do have very effective options for treatment of these individuals. So I would like to leave it at that. Thanks so very much once again for inviting us, and we'd be open to any questions the audience may have.
Go ahead, Ali. You're on mute, Ali.
Yeah, I'm done. I did my rebuttal before diet buy, so
Okay.
happy for you to moderate questions for any of us, I guess, for who's right. So thank
Perfect.
you. It was a lot of fun. Diet buy. We're still brothers, right?
This is the most friendliest debate I have ever seen, and it was just incredibly informative. So we have a lot of questions. So I would love, and thank you once again for an amazing debate. I mean, this topic, I'm sure we can debate for a lot longer than a lot of time we have, but it's been such a great sample. So I would love for Jaswant, Fatima, Dr. Prabhani, and Dr. Khan to join us for questions. So I'm going to mix it up so that everybody is able to have a question. So I'll ask the first question to Jaswant. This question is it 2 hours after the first bite, or 2 hours after a meal to test for blood sugar? What do you recommend, Jaswant?
Thanks, Eva. It's a great question. So I do get this question pretty often when I speak to the patients. So again, what happens is when we eat food, it takes about an hour to 2 hours for digestion. And then we wanted to see if the pancreas is producing insulin or not. So it's a good time to test about 2 hours after. So to answer the question, should it be from first bite or the end of the meal? I believe it is based on the research, it's suggested to be tested from first bite, 2 hours after the first bite you eat, because some people will take longer, others will take a quick short meal, but testing after the first bite, if you take 2 hours after that, that would be good.
Thank you, Jaswant. That's actually an awesome question. Thank you. So we're going to Fatima. Fatima, I apologize again. Your presentation was incredible. I learned so much about just even my diet alone. So that's a discussion that should be not 20 minutes. It should be like a whole hour. So I know that you had mentioned there were a couple of slides you didn't have an opportunity. So I'm just wondering, is there any way you could summarize what you wanted to communicate, please? And then we'll do some questions afterwards. Thank you.
Okay, so I'm just going to reshare the screen. There's just one slide. I was the portfolio diet. I'll send the handout. I just wanted a visual of it for you guys to know there is a name for a vegetarian diet as well. But the slide that I really just want to share and the summary, this is what your plate should look like. Still half your plate vegetables, half grains, and half plant-based proteins. That was my last slide that I missed. That's it.
In terms of your presentation, Fatima,
yeah.
The one question that keeps coming up is you talked about amazing vegetarian diet, but is there a way that audience that we're attending, and is there such thing as a vegetarian keto diet, or is it a keto diet that you can do to help with diabetes? I mean, I know it's not a small question, but please.
The keto diet is like an hour on its own. So basically keto would be where you're doing less grains and more protein, but unfortunately the plant-based proteins have carbohydrates mixed in it. So it's difficult to do a plant-based keto diet. But a lower carbohydrate keto diet is always possible, which, if you have, you can increase your vegetables more and a little less of your lentils and legumes. That will reduce your carbohydrate portions. And of course, rice and roti, that's your main thing that you can reduce. You're still in a healthy zone if you're doing unprocessed grains. And that could help with lowering the carbohydrate. It's difficult to go complete keto with a vegetarian diet. But having said that, I'll just add one quick comment. Keto diet may not be for everybody, so discuss with your healthcare provider whether keto is okay for you before you decide to go on a keto diet.
Wow, that was really a lot to unpack, Fatima. Thank you. That's a really, really good question. There's no safe way to do keto in a vegetarian diet. I mean, it's just really incredible. Thank you. We are going to Dr. Praptani. The question I have here is, once you're a diabetic or so early diabetic, pre-diabetes, can the condition ever be reversed?
Yeah, that's a fantastic question. First of all, I wanted to say, Fatima, Pescatarian, that was new to me. That was an amazing terminology there, right? I'm learning so much in the first bite. Just one, is it if you have dentures or no dentures, does it make a difference? It's just amazing, so many things that can come out of that, right? But no, I'm learning so much from my incredible colleagues that I'm so fortunate to work with. Yeah, so there's actually a study that just came out, published from our own institution. It's a multinational study that, there are patients with diabetes who, if their A1C is well controlled, you can try to take them off metformin. And if their hemoglobin A1C remains less than 6.5% for a certain amount of years, they may be in remission. So definitely, I wouldn't try it in someone who's got an A1C of 10, but someone who's very motivated, who's maintaining their weight, a good, healthy lifestyle, they're very well controlled, they're just on maybe metformin or one other agent, you maybe can try to take them off and watch them carefully, see if they're in remission, as long as they maintain that healthy lifestyle. So I hope that answers the question. Recently published, fresh data.
Wow. Thank you, Dr. Praptani. That's really insightful. I have a question for Dr. Khan. In terms of managing, how are you managing your patients who show dawn effect and causing, of course, hyperglycemia in the AM?
Yeah, so in terms of the dawn effect, so for those who are not aware, it's basically an increase in glucose levels, right at the time that people wake up. And the premise is that some of the steroids that are active at that time lead to an increase in glucose levels at that time. So, one option, those who are taking long-acting insulin, we can always increase the amount of insulin at bedtime, provided they aren't having any low sugar episodes. Those who are taking insulin pumps, we can increase the basal rates, just before the hours that they wake up, once again, watching for low sugar episodes. Fasting sugars, particularly if they're very high, 15 or more, are not very sensitive to medications or lifestyle changes. So oftentimes, we do have to use insulin. However, if they're sort of in the mild range, lifestyle changes can be effective, but beyond a certain point, we do have to make medication changes, particularly with insulin.
Can I just make one comment on that, Siva, to Taibai's comment? Sometimes
Absolutely.
we have to,
go ahead, yeah.
Like Taibai said, that the dawn effect is often due to growth hormone and other glucocorticoid hormones that the body just produces. But I don't have any evidence for this. But anecdotally, people who are under a lot of stress overnight, who don't get a good sleep, they tend to have higher blood sugars. It makes sense, right? I don't have evidence, so if there's some way you can reduce your stress, whether you do deep breathing or do yoga or pray or whatever can relieve your stress, I've seen better sugars in the morning. There's no data because maybe it hasn't been studied. The second thing that's important to realize is sometimes we blame it on the dawn effect, but people might be snacking overnight. So we have to make sure they're not snacking overnight also, right? Simple things, right? Troubleshooting, common sense things, right? So don't always blame it on the growth hormone, right? Think about simple things. And Jaswant and Fatima will tell you about it. I'm sure they've seen this also.
Excellent point, Dr. Praptani. I have a question here for Jaswant. What is the relation between A1C and the blood sugar we measure of at home? If you could expand on that.
Sure. So I think Dr. Praptani and Dr. Khan both sort of alluded to it. So A1C is a measure, it's a blood sugar test, it's a blood test. It's done in the lab. It's basically a picture of the last 3 months of your blood sugar results. On average, how was the blood sugar control over the period of 3 months from the day the test was done in the lab, versus when we do the blood sugar test with the finger prick or the other ways of testing at home. So that's most recent or current, like what your blood sugar is right now or today. So just to give you sort of a little conclusion about, so comparing them to, I wouldn't compare them indirectly, because the A1C is a sort of a picture of average sugar levels in the previous 3 months. But what you're checking right now, it's actually more of the conclusion of how is your current blood sugar is and how you can adjust, look at the patterns. If you need to have medication adjustments, your diet adjustments, your activity level, how is that affecting you today, or what you ate today, how is that effective? That is your blood sugar test on the finger prick. But the A1C is a great test. You wanted to keep track of that. As Dr. Preptani just said, the recent study is indicative of, you probably need to adjust your medications, but that would be like overall picture in the past 3 months. Hope I answered the question of the person who asked.
Thank you, Jaswant. Here we have a question for Fatima. How will fiber increase the sensitivity of insulin?
That's a very good question. So what causes insulin resistance or makes our insulin less sensitive is saturated fat. So when we have a diet which is higher in fiber and lower in saturated fat, automatically that helps reduce insulin resistance. Fiber, specifically soluble fiber, actually cleans out our arteries and actually helps in blocking the absorption of fat from the gut, from the intestines. So that reduces saturated fat, which causes insulin resistance. It's a combination of increasing fiber, which reduces saturated fat, which helps in reducing insulin resistance and increasing insulin sensitivity. I hope that answers the question.
Perfect. Thank you so much, Fatima. Here I have a sort of a follow-up to what Dr. Preptani was talking about, and it could be sort of packaged. Is metformin habit forming, and can pre-diabetes expect to get out of it if somebody's pre-diabetic condition?
Yeah, so first of all, no, it's definitely not habit forming, unlike, narcotics and other drugs that people shouldn't be using in excess. So number one, that's the easy part. The second part is just like in someone who's had diabetes, on type 2 diabetes, we're specifically talking about type 2 diabetes here. If someone's been on metformin for diabetes, they can come off to see if they're in remission with your healthcare provider's discretion, whether it's a nurse practitioner, someone like Jaswant, or the diabetes team, or your diabetologist, to see if they're in remission. But the same goes for pre-diabetes. We have data that Diabai presented that metformin in someone who's pre-diabetic can decrease the risk of type 2 diabetes over time. It doesn't prevent probably, but it just delays. So the question is can you come off as a pre-diabetic? Yeah, you can come off if you made some other healthy lifestyles, but based on the data, again, if you extrapolate, you probably won't get the benefit of delaying the diagnosis of diabetes, because that's the reason after you're going on to metformin, right? But if you've made a lot of other significant lifestyle changes where lifestyle is actually more powerful, then maybe you might be able to come off to see if that weight loss, the dietary changes, the plant-based, decreasing processed foods and low glycemic index stuff, maybe you might just do well with the lifestyle, which is so much more powerful than any medication that we know of. There's only one other stronger intervention outside of lifestyle that can prevent diabetes. That's bariatric surgery, right? And now we have this drug called tirzepatide, which might change the whole landscape of diabetes. That it's not approved in Canada yet, but it's actually approved in the US, right? We just found that out in the US. So we'll see what happens with that.
Actually, this is sort of like follow-up to that, is after metformin, what are the second level medication with minimum side effects seen in, like, I guess, in statistics for type 2?
That's an excellent question. I don't know, I think we will both have the same approach, but I'll give my 2 cents. That takes about 6 years of training. So it's we Jaswant and Fatima, we do personalized medicine, right? We look at that patient in front of you and make a decision. Metformin is usually safe, it's cheap, it's effective. We use it as a first line, usually. Well, how do we decide on the next agent? We look at their A1C. We look at their side effect profile. Are they pregnant? Are they not pregnant? How high are their sugars? Is it a postprandial? Is it preprandial? Do they have established heart disease? Do they have established heart failure? Do they have established kidney disease? We're going to look at, and do they have coverage and cost issues? We're going to look at all these things. then we're going to make the right decision for that patient. So it's personalized medicine. So it's not like a cookbook where you say, just add dana jiru or add this. We're going to look at the entire recipe here of that patient sitting in front of you to make that decision. That's why you need a healthcare provider who specializes in diabetes. And it doesn't have to be a doctor. It could be someone very competent like Jaswant, right? Who's doing a lot of diabetes, can make that decision also in conjunction with the whole team. It's a team approach. Dayabai, did you want to add anything to that?
No, not necessarily. I mean, it's basically personalized and individualized, and also, like we do have these injectable medications that, you mentioned, which are very, very effective, but some people just don't want to take injectables and would rather just take oral medication. So there's a lot of, back and forth with the patient, and it's based on patient's own preferences and their risk factors.
Did you want to add anything to
that? I have a quick question that just came up. What is the name of the medication Dr. Khan mentioned in his presentation?
Yeah, so it was tirzepatide that Dr. Prasthani just mentioned, was just approved last week in the US and will likely be approved here in Canada as well.
One last question for
at $12,000 per year.
For Fatima, can you quickly talk about intermittent fasting? Is it a good for managing diabetes?
Okay, so intermittent fasting, again, it's a very vast topic, and there's various different types of intermittent fastings that people do. Definitely, if you can go a substantial amount of time without eating, it will help to bring your blood sugars down. But again, it's not for everybody, and it has to be personalized to what you are doing. It also has to be something that you're able to make a change, a lifestyle change, and adhere to that change. It's not something I'm going to do today and then I'm off it tomorrow. It benefits you while you're using it. Once you're off it, you're back to square one. So remember that before starting intermittent fasting. Yes, there is a place for intermittent fasting for diabetics to help their blood sugars come down. It has to be discussed with their diabetes educator or their doctor or their family doctor or endocrinologist to adjust and find out medication adjustment based on the intermittent fasting, diet adjustment, as well as exercise adjustments. So talk to your educator or doctor before you decide what type of intermittent fasting you want to do.
Thank you, Fatima. A quick question for Dr. Khan. One of the respected MD in US had advised to take herbal medication, berberine. I don't know if I'm pronouncing it right, compared to metformin. And is there any reason that berberine is more effective and no side effect? And a person is taking it and they've been pre-diabetic for 10 years. Is there any proof in it at all? If you can shed some light.
Thanks very much for that question. I wish I could. The issue with herbal supplements, in my opinion, is not necessarily about the knowledge whether they are effective or not. But the issue is that to the best of my knowledge, I don't think that they've been studied as extensively as some of the medications we have. So we don't know about efficacy and then about side effect profile of these herbal agents. That's to the best of my knowledge. Like there's a lot of people tend to prefer bitter melon, etc., herbal supplements, but they have just not been tested to the same amount of rigor. I don't know if Dr. Prasthani has something specific about berberine, for instance. I couldn't find much.
No, I agree. In fact, I was asked this. I just did a session for another country a few weeks back, and I was asked the same question about berberine, and I couldn't find any data. And I agree with Dr. Tayyab that they just haven't been studied. Now, that being said, if they're safe, I don't discourage from patients to take it. I just tell them to be cautious to make sure they're getting it from a reliable source, because sometimes you don't know what's they're putting in there. They're not regulated, right? We don't know what's going in there. So I just say, be careful. At the end of the day, eat healthy, lifestyle, okay? Don't waste a lot of money on all these vitamins and stuff. There's only one vitamin actually that really stands the test of time, that's probably safe and effective for most people, is vitamin D. All these other vitamins, unless you're deficient, you're wasting your money.
Thank you, Dr. Prasthani. And sort of packaged with metformin, is there any evidence of long-term usage causing kidney disease with that?
No, metformin is very safe. It doesn't cause, in fact, it has no real toxic side effect. It's a very safe medication, years and years of use. Now, if you have kidney damage already to begin with, whether it's due to high blood pressure or diabetes or another reason, then you might need to reduce the dose, or if it's very bad kidney function, you shouldn't be on it, but it doesn't cause kidney damage. Diapai?
Agreed, for sure.
Can the body get used to using, no side effect, long-term use? Can the body get used to using metformin?
It really doesn't get used to it, but with time, like Jaswant was saying, or Kawal or Fatima, I can't remember, but diabetes type 2 is a progressive condition. So with time, you may need other therapies, especially if you're starting to gain weight. So it's not that you get used to it, but eventually your pancreas will start making less insulin. You may become more insulin resistant. So you may need additional therapies.
Thank you to all the presenters today. It was just incredibly informative, and thank you so much for all the amazing questions that came through and you guys answering, and great presentations, Guy. I'm going to move it to the organizer. I'm going to move it to Sandanand to do some closing remarks. Thank you.
Thank you, Shiva, for that efficient and effective moderating. Really enjoyed it. It was really great meeting Kawal and Jaswant for the second or third time. And I'm really happy to be able to meet with Fatima, Dr. Guptani, and Dr. Khan. I had heard about you so much, but we never got a chance. What was more fun was the two doctors calling by each other, arguing against each other. So next time we will give you more time, and if necessary, we'll bring the gloves too. That would be really fun, especially if it is in person. As I had mentioned earlier, this is a Diabetes Canada and South Asian Diabetes Chapters program. However, 3 other organizations had put lots of time in planning, organizing, and promoting. So I'd like to give 1 minute each to them. First, present to you Param Bhatt from SVBF. Param?
Thank you, everyone. It has been a fantastic eye-opener for me, and probably we got $1 million worth of information in the last hour or so. And I'm a newly diagnosed pre-diabetic, and we don't want to accept our issues. And this kind of seminars and information would help us a great deal to manage our lifestyle. I specifically want to thank all the presenters, Siva and Sadanand, for organizing these programs. And just in conclusion, with the due respect to Dr. Preptani, Dr. Khan, I was told by someone that sometimes even God can appreciate some help with the medications when the nature is working against you. So don't be afraid of taking the medications, but consult a proper qualified doctor. Thank you all once again.
Thank you, Param, for those wise words. I will remember that. Next, I'd like to invite Mr. Varadraj Saud, the president of the Konkani Association of California. Varadraj?
Yes, Sadanand. Good morning and good afternoon, everybody. Great presentation. I think I personally learned more in the last 2 hours than I had learned in the last 10 or 15 years, actually. I like the enthusiasm and the energy and the content, especially the way it was presented, and for including both the lifestyle as well as the medication aspects of it. Looking forward to more, and thanks to Sadanand for, Oka for putting this together, and Kauka definitely benefited from it. I'm sure the recording will be viewed multiple times. Very educative. Thank you very much again.
Thank you, Varadraj. Nice seeing you again after a long time. We'll be seeing you within a month or so soon. Take care. Okay. Finally, I'd like to present with great pride Anjana and Praveen Pai, the presidents of my Ontario Konkani Association. Anjana?
Thank you, Sadanand ma'am. What a wonderful event. I think I learned a lot. I have a personal connection to diabetes because my mom was diabetic for a long time, and she passed away at a very young age from a cardiac arrest that was because of uncontrolled diabetes. So it runs on both sides of the family. So it's personally a very close cause to me. Thank you very much, Diabetes Canada, for the opportunity of hosting such a relevant and informative event. Thanks, Siva. Thanks, Dan and Mom, and to SVBF. So I think this event was helpful not just for seniors, but also for the Southeast Asian community at large, as this affects all of us. Thanks to our expert speakers, Kawal, Jeswant, Fatima, Dr. Preptani, and Dr. Khan, for giving us all the information on the various aspects from diet to lifestyle, exercise, medication, everything. I especially enjoyed the friendly debate. Looking forward to many such events. Thanks also to SVBF and Konkani Association of California. And last but not least, for the audience for your active participation and asking very good questions that some of us were probably thinking anyways. So thank you, everyone.
Thank you, Anjana. All three of you have said what I would have liked to say, so I'm not going to repeat it. Thank you. And once again, thank you to the audience. Please share the words. We will try and share the recordings with all the email group addresses within the next short time. Once again, thank you all. One thing I want to remind that our next program is on June 26th. It will be a freestyle Libra clinic, where Abbott representative will be giving us the details on the continuous monitoring. As a matter of fact, they have said to me that those who register and request, they would more likely get a complimentary sample. So I will send the details in a short period. In the meantime, take care, stay healthy, stay happy, and stay connected. Thank you all. Bye. Anjana, we can turn it off.
Thanks, everybody. Have a great Sunday.